Hi, my name is Brittany Maher, and I'm a physical therapist for Bon Secours. Physical therapy is an excellent conservative treatment to try to prevent or avoid a joint replacement for joints including hips, knees, and shoulders. When you typically need a joint replacement, you have a ton of pain, loss of range of motion, and loss of strength. So if in physical therapy we can try to regain your mobility and your flexibility and strengthen the muscles around your joint, typically you have less pain and then you don't need to have that joint replacement. In physical therapy, we try to focus on regaining your flexibility and your strength to strengthen the muscles around your joint to offload pressure on that joint. So a lot of times you'll do some type of warm-up in the beginning to try to get some blood flowing into your muscles. We focus a lot on stretching the muscles around the joint that has the pain or the arthritis, and then stretching any other related muscles. And then once we regain some mobility by improving your flexibility, then we want to strengthen those muscles. So you may do some type of functional strengthening exercises, like practicing going up and down stairs and sitting up and down from a chair. You may do some exercises with resistance with TheraBands, or maybe some type of weights, depending on what joint it is and what your functional goal is. The overall goal for physical therapy is to decrease your pain by improving your flexibility and your strength to support those joints so that your quality of life is better and you can get back to doing the things that you want to do while also avoiding or preventing surgery.